Hi, this is Dr. Varisa Perlman with La Petite Creme, and we are doing our podcast called Beyond the Diaper, which is a time for us to chat a little bit about caregiving, child rearing within the context of medical education. So I have with me a special guest today, Dr. Obehi Okojie, who is a person who wears many hats. Let's just put it that way, right? So between being an integrative pediatrician, being a postpartum healer, and also a parent coach, there are many different intersections. So today what we're going to discuss with Dr. Obehi Okojie. Do you like to go by Dr. Okojie?
Yeah, Dr. Okojie.
So Dr. Okojie we're going to go through all the different hats that she wears and try to tease out kind of like take home points so that, our listeners and our viewers can see that there are many ways to bring healing to a family, which I think is really beautiful, right?
It's really beautiful.
So tell me a little bit about your journey and a little bit about, where these fields kind of like fit in your view of healing.
Okay, journey like to medicine or
Just
just to,
even to like in your decisions to kind of like
oh,
touch all
do
these different
different
points.
things. Yeah, okay,
Yes.
great. So, as far as the parent coaching, that came first. I've been a parent coach now for 6 years. I got trained in 2020. And it was because as a pediatrician, the first thing that I get all the time, of course, is, running nose, ear pain, sorry,
Hmm.
sore throat, that kind of thing. But then other than like communicable diseases is what we call them, like diseases you can get from other people. Other than that, the second thing that I get most common is behavioral concerns with their children.
Hmm.
And so I didn't really have a lot to say, if I'm being honest. I don't
Hmm.
know if you feel this way, but as a pediatrician in my training, we really didn't do a huge deep dive into like strategies for parents on how to like
No,
parent.
nope.
Because there are resources for that, right? Like we leave it to like the occupational therapist or the talk therapist, the play therapist, the psychiatrist, whatever, right?
Hmm.
And we do our little medicine thing over here, right? And but they were coming to me for this, and I didn't have a really good answer other than
Yeah.
structure and be consistent, which
Hmm.
is true, but like what
Hmm.
structure? Consistent how? Like what does that even mean? Like that's
Hmm.
so vague. And so I got trained so that when parents came to me, I'd have something to say. So
Absolutely.
so I became a certified parent coach, and now I have a whole coaching program. So
So
six
so let's
months.
talk about that first.
Yeah.
So I absolutely agree with you. It is a huge kind of like, I don't want to say like weakness, but it is kind of a blind spot for a
Mm-hmm.
lot of conventional medicine. There's a
Yeah.
lot of those pieces that go in between all of the strictly medical information.
Right.
I mean,
Right.
even as something as simple as like the child is sick, has an ear infection, but he won't take the medicine.
Mm-hmm.
That all you've moved from something medical, right,
Mm-hmm. Mm-hmm.
to something that is somewhat behavioral.
Mm-hmm.
And in that sense, as a pediatrician, there's always this weird expectation, oh, you guys will figure it out. It's not a big
Yeah.
deal.
Yeah.
Right.
Yeah.
And in many ways, it's like, you figure it out because you have your own kids, you figure it out that way. But in many ways, that should be a very integral part of our training to
Mm-hmm.
be able to listen to parents when they're really concerned. Because in the end of the day, if they can't figure out a way to get that kid to take that medicine, guess what? Your fancy medicine means nothing.
Right.
And I think that extends all the way through different things that we recommend people do to stay healthy. We're very vague and we're
Mhm.
like, just be healthier and just do
Yeah.
it. But we don't get those concrete points. So you went back and you're like, I need concrete
Yes.
points
Yes.
so that I can stay in the conversation. I don't have
Yes.
to outsource that conversation
Yes.
and stay
Yes.
in it. Right. So,
Yes, absolutely. Because
which
what
is
was
annoying.
happening was, even though I was sending them to occupational therapy, which was helpful, and I was sending them to psychiatry and I was sending them to play therapy, still something wasn't shifting in the home. There was still a
Yeah.
hole, there was still a gap there in terms of parenting and getting the child to listen to the parent. And
Yes.
so that's what I got trained in.
Yes. And my favorite part as a health coach as well is that I love kind of that discovery process where issues that they have with their children give them a moment to reflect on their own
Yeah.
kind of struggles and shortcomings and baggage and trauma. And so I love this kind of like circular healing kind of
Yeah,
idea. So,
absolutely.
and one of the things that we'll revisit later, this idea of that they're born the way they are
Yeah,
to heal the family, that children are
yeah.
here to heal you. Part of that process is when you go to work with your children and realize that some of the issues are actually coming from you and not necessarily from them.
Yeah, it's so great that you say that because I do a lot of that work in my coaching. So I'm a parent coach. I'm also a life coach, trained life
Hmm.
coach. And so I do a lot of that in my training. And I think that is my genius zone. And that's what sets me apart from a lot of other parent coaching material is because a lot of other
Right.
parent coaching material focuses on the child and strategies that work for the
Yes.
child. And I have all of those as well, science-backed,
Right.
proven strategies that work.
Right.
And I also deal with not only the nervous system of the child, but the nervous system of the parent.
Yeah.
Because a lot of times it's true that if you stay consistent, it will work. Whatever method of discipline you choose to use, if you stay consistent, it will work. The
Right.
problem is parents have a hard time staying consistent. Now, why is that? And that's where I go to work. What is it that's
Yes.
triggering you that in that moment you know what you're
Hmm.
supposed to do and yet you don't do it? Because either you just like fly off the handle or you're too
Yeah.
overstimulated or too overwhelmed, you just give in or whatever the
Yes.
case may be. But
Yeah.
so there's that's going on too, that's really perpetuating what's going on in the home. And if parents are willing to go there, which my clients are because that's what I do,
Yes.
then we can untangle what that is and we can stop this forever. You don't have
Hmm.
to get triggered. You really can't hold the
Hmm.
party line. You can be firm but kind, and this is how we do it. We do
Yeah.
have to go back to some of those triggers that you had as a child and work
Hmm.
on completing those and disappearing those so that your child doesn't have buttons to press anymore because you
Yes.
healed all those wounds, right?
Well, I mean, it's so gratifying to do that. I think the thing that parents underestimate and people, adults underestimate is how empathic children are, especially the
Hmm.
toddlers. The toddlers, they can like smell all your fear and your guilt. And, I always say fear and guilt are like poison, right? And they can literally, smell the fear and the guilt on you. So if you don't identify those kind of triggers, that trauma, and then you kind of lift them out, every time you go to approach that child, all they can smell is
Yes.
fear, you know?
And they're taking that
Yeah.
on, right? So we
Yes.
know about mirror neurons and how
Yes.
you're giving your nervous system to your child. So however way you're feeling is how what they're going to absorb in the way that they're going to feel. The way I
Yeah.
like to describe mirror neurons is like when you're feeding someone and you go for the spoon and you go like every time you open your mouth whenever you're feeding someone else, those are mirror neurons. and
Very cool.
um and it's so I like to tell a story about because I am a doctor that sees people in the nursery. So I have a clinic, and then when I'm not in clinic, well, actually, sometimes even when I'm in clinic, but on the weeks that I'm on call, and I'm actually on call today, I need to make sure that
Mhm.
the yeah, make sure the hospital wasn't calling me. When I'm on call, I man the nursery, the my clinic when I have clinic, the critical care unit, the hospital floor, urgent care, and the ER when they need me. If they need me, they call
Yeah.
me in. And so in the nursery, when I have babies who are kind of borderline, so let's say I got called in because the baby had respiratory distress, had a hard time breathing, and a lot of times like we can sometimes they'll be borderline. So like we can get them to a point where okay, their temperature's good, their heart rate's good,
Hmm.
but maybe they're breathing a little fast, or maybe they're even like grunting, which is a noise they make when they're struggling a little bit to breathe.
Hmm.
And but everything else is fine, but they've got this, their oxygen is fine, but they've got this one
Right.
vital sign that isn't quite right. It's not normal. And we're a small regional hospital, and we have a normal newborn nursery, which means we can only take babies who are healthy. If there's something else going on with them, we have to transfer them to a bigger institution.
Right.
And so I'm on the cusp. Should I transfer them? Can I keep them? What do we do? What I do in those instances is I always give them to mom. Skin to skin. It has to be skin to skin.
Mm.
And for me, skin to skin is like medicine for those babies.
Wow.
Almost every time, I'll say 98, 99% of the time, the baby's correct.
Hmm.
Because it's like mom's heart is like, okay, here's how you beat, here's the rhythm. Mom's
Yeah.
lungs are like, here's how you breathe, because they don't know how to exist in the outside world. And so
True.
mom's body is like teaching them, here's the rhythm, this is how you
Yeah.
breathe in and out. And it's reminding, because they forget to breathe sometimes. It's reminding them you have to breathe.
Right. Yeah.
And so
It's a
all
good
these things,
reminder.
it's regulating the body temperature, all these things. And the babies do beautifully, and then they're able to eat, and then their blood sugar comes up, and then they do beautifully. and
Yes.
and so that transference of energy,
Hmm.
that happens really until your child dies. Forever it happens. You're
It
transferring
happens
that
a
energy
good
to your
long
child.
time. It's
Yes,
it's pretty
you're
forever.
transferring that energy to your child. And so when you show up to your child anxious and overwhelmed and
Hmm.
overstimulated, and that's what you're pouring out of your cup, what do you think you're pouring into your child? Right?
Yeah, that's a great way to describe it.
They're still grabbing all of that. And so we do a lot of work in my parenting program around calm,
Hmm.
staying calm. And parents often say, well, how do I stay calm? Because truthfully, I work with a lot of millennials. And as a
Hmm.
millennial, we probably had boomer parents who did not spare the rod. Okay. They were on us like white on rice. Okay. They yelled at us, they hit us, they did all kinds of stuff that we vowed to never do to our children.
Yes.
Okay. When we were 4 years old and we got slapped for the first time or
You're
yelled
like,
at,
no, right?
we said in that moment when we were 4, 5, 6, 7 years old, I'm never going to do this to my child. Right. And so now we have a child, and we want to honor what we said when we were 4, 5, 6 years old, and we're too afraid to hold a firm boundary because we don't
Yeah.
want to be like them, and we end up parenting in a way I don't want to be like them versus the fullest expression of who we are now that we're in our
Hmm.
30s and 40s.
Right.
Right?
Right.
And so we do a lot of that work, and as millennials, we're overstimulated because we didn't, oh my God, how many disasters can somebody have in one life? It started
Literally.
with Iraq, and then there was the housing crash, there was the dot-com thing, of course COVID. There's been so many things. There's been 9/11,
Right.
let's not forget. There's been so many things that have happened in our lifetime. We're just fried. Our nervous system has been fried for the past decade, okay? And so we're overwhelmed by default. And now we have a strong-willed child because we're strong-willed, and we're like, how do I stay calm? And
Yes.
so that's where I go to work in my parent coaching program.
Yeah, and I love that. So you what you see is that full circle, right? So the parents learning how to stay calm so they can be present for their kid, and then their kid is more calm. But guess what? You got a two for one there. You got a two for one. And that was pretty awesome. So speaking of the parent, let's go, 6 months earlier. Let's go a year earlier. You're dealing with people who are, pregnant,
Yeah.
walking into having this child,
Hmm.
and having this child leads into postpartum,
Yeah.
right?
Yeah.
So, this is a whole length of time that you're seeing. So, you're not just seeing this older, when we think of pediatrics, it's like we are really sitting in the middle of a
Hmm.
lot of action going, right? And,
Hmm.
so you're seeing this kid been born, you're dealing with the parent, you're trying to get this kind of connection going on, understanding both dynamics. But who really gets lost in all of this is the postpartum mom.
Yes, absolutely.
So let's go into that.
So I call myself a postpartum healer. So I'm an integrative medicine doctor, meaning I'm trained in osteopathic manipulation, which is body work, acupuncture, hypnosis, abdominal massage. Of course, I do coaching, and I'm also trained in lactation. And so I go into the home after mom's had the baby, and I help her with all of these things, and I help her body heal.
Hmm.
I also treat baby, and I also do all the medical care for baby in the home as well,
Yeah,
so that mom
great.
doesn't have to leave. So
Yeah.
that's my postpartum healing that I do. Now, women started to become a demand for this while they were pregnant. So now I actually have a program while you're pregnant. I've come in and treat you and do all these things with acupuncture
Correct.
too. So I
Correct.
now have that program too. So I treat you during
Yes.
pregnancy, postpartum, and then I can see your child after. But
Yes.
so with the postpartum, how that started, my youngest is 1, and I have a 3-year-old. And with my first pregnancy, my mom came and stayed for a little while, but then she wasn't retired, so she had to go back to work.
Hmm.
And, their dad was working, and so I
Yeah.
felt myself alone.
Yeah.
And I was like, well, hold on.
Hmm.
Who's going to take care of the mom who is giving
Mm-hmm.
all of herself to keep this child alive.
Mm-hmm.
It's very easy to forget yourself in the milieu of trying to keep this new human being alive. And
Mm-hmm.
you're consumed with it. You forget to eat and drink, and you're not
Yeah.
sleeping.
Yeah.
And I found it more difficult than I thought it was going to be. Just immediately coming home from the hospital, I'm like, okay, hold on. I got to count how many wet and dirty diapers this baby is having, how many
Yeah.
times they eat, how many ounces they ate per time. And then also I got to remember to take my Tylenol and ibuprofen every 6 hours
Mm-hmm.
and make sure
Mm-hmm.
I'm eating and drinking and going to the bathroom. And going to the bathroom is a struggle right
A
now.
struggle. There are
So
no words. There are no words.
I was like, who is taking care of mom? And so with my
Yeah.
second baby, I was like, I'm not doing that. That's for the birds. I was like, I'm gonna find a program that's gonna take care of me. And so that I
Yes.
can sort of enjoy this postpartum period. And mind you, I'm kind of weird in the first 3 months of a baby's life are my absolute favorite as a mom. I just love the
Mm-hmm.
whole being home with them,
Sure.
breastfeeding, having them be
Mm-hmm.
like the number one priority, doing nothing. I just love it.
Right.
So I loved it, but I was exhausted and it took
Yeah.
me longer to heal because I was up and moving around all the time when I shouldn't have been and all these things.
Yes.
So with my second baby, I was like, okay, I'm gonna find a place that I can be nurtured and taken care of,
Yeah.
at least in the first immediate like couple weeks when I'm like healing and stuff.
Yeah.
And I looked around and all I saw were hotels, and they have them in a lot of different areas. They have them in DC,
Right.
New York,
Right. Right.
California,
Right.
Atlanta.
Right. Right. Right.
Um,
Right.
and I saw these hotels that, they had nurses that were like newborn nurses that would come in and do like the nursing education with you. They would help you with a little bit of lactation, and they did feed you. That was
Mm-hmm.
one nice thing. But there were hotels that were kind of like, I don't know, like sort of retrofitted for this
Right.
design.
Yes.
And so I asked them, okay, what do you do for like a sitz bath? Because, right away, they tell you to
Yeah.
sit in warm water because, you're healing that
Right.
part where the baby came out. And they were like, oh, well, we just put this thing on the toilet. It's like, the little plastic thing that you get from Walmart that you put on the toilet. I was like, why don't you do
Mm.
that at home? They didn't have a tub or anything. They had just a regular hotel shower. And I was like, okay. And they didn't even have like a hospital bed or anything. It was just like a regular bed
Yeah.
that lay flat. I was like, okay. And at least they like I said, served you food. But then if your partner wanted to stay, that was extra and all this other kind of stuff.
Yeah.
And they had the nurse that did the training. But if you wanted a pediatrician to come see you, that was extra. If you wanted acupuncture, that was extra. If you wanted a
Yeah.
massage, that was extra. If you wanted a lactation consultant, that was extra. Everything was extra. And this was $1,000 a day. I'm like, okay, well, what am I paying for? For you to feed
Yeah.
me for $1,000 a day?
Yeah. Yeah.
And I was
No.
like, and I could do all this at home. I had an
Yeah.
acupuncturist at home. She came to the house to see me the first time postpartum.
Yeah.
And I had bought an adjustable bed. One of those adjustable
Sure.
beds.
Yes. Yes.
Because during my pregnancy, because my first one, I struggled. I slept on the couch the whole time. So I was like, you know what? I'm
Wow.
ready for this. So I bought an adjustable bed with my second pregnancy. So it was really nice.
Yeah.
It really helped me breastfeed. You could sit it up.
Yeah.
It helped
Yes.
with
Totally.
positioning.
Right. Right. Right.
And I had a tub that I could sit in. I was like, I don't need
Yeah.
this. I could do all this at
I
home.
know. I
And then I
know.
started thinking, I'm trained in all these things. I can do this.
Right.
I can go to people's homes. I can treat them with acupuncture. I can help them with lactation. I can help help the baby. I can, be the
Yeah.
pediatrician. And I won't charge extra for all of that. It'll just
Hmm.
be part of it. And for
Right.
a fraction of the price.
Right. Right.
Because I was like,
Absolutely.
this kind of care should be affordable.
Yeah. Yeah. And I think it's that kind of thing where we talk a lot about the modern day world where we've like taken out the village, where we kind of, you know, if we're gonna have people come, we're gonna have to pay them, right? So
Right.
then that cuts off a lot of people. And just kind of having, an understanding that the support is there and that you need the support, but at the same time, it's not a party. Like you're not coming over for me to entertain you.
I'm not going to
You're
host
coming
you.
over. Yeah, yeah. We're not hosting. And I feel like, like somewhere along that way where it kind of segued from like, this person is coming over to do your dishes. This person is coming over to make some food for you.
Yeah.
This person is coming with the explicit reason to
Right.
do your laundry, to make
Yeah.
sure that you have rest and care, to like, I'm coming over and then, what are you serving me for dinner? Like,
Right.
somewhere along the way, the boundaries got
Yep.
really
Yep.
sketchy.
Yep.
And then we found ourselves being like, okay, then I don't want anyone coming over. Like I don't want
Right.
anyone. But
Right.
then that's not right either because you need all hands on deck.
Right.
So all the things that, the thing that's fascinating is that myself included, we learned this because we had children. We
Yeah.
didn't learn this because we're pediatricians. And
Yeah.
yet we are assigned the task to take care of a child, a baby who is dependent on an adult who is flailing, right? So it's like,
Yes.
if you do the math, if really our job is to take care of the baby, we can't take care of that baby if we don't take care of mom.
Right.
It's just
Exactly
the
right.
math is there, and our
Right.
training should have included that, right? Or at least that perspective, or that question, or that idea. And I think that's the part that has been a little bit strangely disappointing, right?
Yeah.
Because, we've done such a great job in modern day medicine to silo. We just
Yeah.
silo. And then what ends up happening is that it becomes a really stupid game of hot potato where they're like, not my job, your job.
Yes.
Not my job, your job. And I mean, I've had situations where I've asked, like, you should talk to your OB. You've seen you might have an infection where you're like breastfeeding, and they're like, I went to the OB. The OB said that that's not their job. They're supposed to take,
Yeah.
and so then I was like, was that my job? Like, I can't prescribe you antibiotics. And it becomes a really dumb game of that.
Yeah.
And what I'm really enjoying about this generation of pediatricians is that we're seeing the gaps.
Yeah.
And we're like, clearly the gaps exist because the system, which is this large body of people, is very slow to move. But you know what? Let's start the ball rolling and filling in those gaps so that we can, in the end, I still feel like when you take care of a parent, you are taking care of the child simultaneously.
Yeah.
This person who takes care of them for 24/7. So it behooves you to do that effort to ask those questions. So that work is really amazing that you're doing.
And
Yeah.
everything you said is the reason why I'm opening my own direct primary care practice for pediatrics and wellness, because of
Yeah.
everything you said. And the system is very slow to change. And the system, I just gotta be honest with you, the current healthcare system is not about health. It's a business.
Yeah,
And us,
unfortunately.
and unfortunately, and
Yeah,
us
yeah.
individual doctors, we actually
Right.
are about health. Believe it or not, I don't know how
Yeah.
doctors became the face of everything wrong with healthcare, but we're not
Yeah.
about that life. We're
Yeah.
actually about health and
Yes.
wellness and well-being and making
Yeah.
people
And
healthy
healing,
and healing.
right?
And so
Healing.
that's why I'm leaving the system, because it's not aligned with what I'm aligned with.
Yeah.
And I'm bringing all of my integrative approach to the child into my practice. So I do all of this integrative medicine included because I want to heal the whole body, and I bring all
Yeah.
of my coaching to it because the mind is just as important, if not more important, than the
Yes.
body. I tell my kids, your brain controls your body, you control your brain.
Yeah. It's very interesting. I was at it was kind of a person that did acupuncture, naturopath, really kind of had their hands in a lot of different things. And in their waiting room, they said, conventional medicine believes the body is ruled by the blood. Traditional medicine, which I go back to like kind of traditional Chinese medicine, homeopathy, acupuncture, believes that the body's ruled by the nervous system.
Yeah.
And, in conventional medicine, we run around trying to measure blood work, right? It's all about the
Yeah.
blood work. But
Yeah.
the truth is that it's not that easy to measure the nervous system, right?
Right.
That's a little bit harder. And so in a business, if you can't measure it, you can't throw medication at it,
Right.
you're not going to make any kind of money from that, right? It becomes a situation where everyone's like, do we really care about it then? And
Right.
that's a bad conclusion, right? Because
Yes.
the conclusion should be, is it a doorway to healing?
Correct. The
Yeah.
conclusion should be, is
Yeah,
it
yeah.
helping the body
Yeah,
heal?
yeah, yeah, yeah. Then let's walk through that door,
Hello.
versus
Exactly.
whether or not is it going to create a profit. So I think
Yeah.
that, the idea of going back to the game of healing, the world of healing, right? What we were seeing as people who kind of sit between the worlds of conventional and traditional medicine, right? Is that I felt that my conventional medicine could only go so far, right? There was just a point where it just couldn't jump over and really heal. It's a lot of
Absolutely.
band-aiding, a lot of kind of
Absolutely.
like getting by, but was it really healing? I questioned that. And I believe that going kind of historical, going back with my parents are both pediatricians from Thailand. And, I always say that they would go to like the kitchen before they would go to the medicine cabinet. When it was,
Yes, I
if
love
there was
that.
an issue, they would go there first. And so in many ways, food is your first medicine.
Yep.
And this idea that we we're kind of gazing back to what traditional practices are, really caring for people in a village, right? As opposed to, coming in and being like, I'm just coming in to be cared for, as like a guest in a postpartum home is just the silliest thing I've ever heard. And so little concepts where they've been tweaked, we need to tweak them back
Tweet him back.
because people tweak it back, go back to what we were doing before. And in many ways, a lot of that healing will come. So I
Yes.
will, right. So I wanted to ask you a couple of fun questions, kind of like a fire round of questions,
Yeah.
and see what you think. So my first question is based on the idea of self-care. So as someone who cares for others, I want to know, what's the last thing that you did that was only for you, and when did you do it?
Oh, that's good. The last thing I did that was only for me. Um, the last thing I did that was only for me. I mean, I pray. So I do a little bit every
Mm,
day. And this is what I
nice,
teach my parents, that it doesn't take long. It could be 5 minutes a day, but you need
nice.
to somehow do a little something for you that refills your cup.
Yes,
And so I
nice,
slash meditate slash affirmation type of thing. I usually do it like when I'm
beautiful.
ready in the morning, like shower, bathroom, whatever.
Love it,
Um,
love it.
so I kind of do
Yes,
that every morning. And I love to
yes.
travel. And so I'm a
Okay.
really hard worker. You can tell I've got like three businesses. And then
Yeah,
so I go like pedal to the metal and then I take a
yes.
vacation.
Right.
And
You
I do
work hard,
that
play hard.
often, like every other month. It's like a
Yes.
weekend,
Yeah,
but
great.
it's necessary.
It's necessary. And I think it's a kind of, I asked this question, it's kind of a trick question, because I'm assuming that when I say how recently, it was yesterday or today, right?
Yeah,
It's something you do. And I really want people to get into the mind frame that it can't be, oh, I got a manicure 2 months ago. Like that was
right.
for me. No, no, no. Like every day should be a little something, right?
Little
Because we
something.
we ask of our body little tweaks every day. Let's give back to ourselves a little every day. So for me, it's like a 10 minutes of watching some like guilty pleasure, like, some silly TV
Yes.
that makes a difference, because
Yes.
I feel like it's something that's just for me
Yes.
every day. So I kind of appeal to caretakers in our world to take care of yourself. It doesn't have to be 2 hours. It can be 10 minutes. It can be five
Absolutely.
minutes. It can be in the
Absolutely.
shower. It can be,
And that
but do something every day with intention.
And that reminds me, so a lot of people in the car will listen to podcasts and different things like that. And I often tell myself, oh, I should be listening to a book. I should be listening to a podcast. I'm
Right.
wasting this time in the car. But honestly, similar to your show, like
Yeah.
right now, I have SiriusXM, and right now it's on
Yeah.
Radio Andy.
Yeah.
What do
Yeah.
they talk about? They talk about Bravo,
I
Housewives,
love it.
absolute
Yes.
nonsense. But I don't even know what's going on
Love
because I don't
it.
have time to watch them. But it's
Yes.
just such juicy gossip. I'm like, whatever,
Oh,
I'm listening.
yeah. It just fills the cup. I don't know what nonsense, and nobody else has to enjoy it. I'm the only one who has to enjoy it, and it's wonderful. So I really appeal to people to give themselves a little something every day. The second is, we talk a lot about children being born to heal the family. So what is one way your children, and I'm sure there's numerous ways, but one way you can think of that your children have healed you?
It actually started with my stepdaughter, who is going to be
Mm.
8.
Okay.
It was like it's a kind of a contentious situation there,
Okay.
with the parents.
Sure.
And so I always sought to bring calm to the situation.
Yeah.
It's true, and no one believes this, but I've known her since she was a year, and I've never ever raised my voice at her one time.
Yeah.
Because I thought to myself, it's just not worth it. Because she's going to go home and she's going to say, this woman raised her voice at me, and it's going to like literally end up in court.
Yeah.
And so
Yeah.
I trained myself, it's not
Yeah.
worth it. Don't raise your
Right.
voice. You don't need to do that
Yeah.
to get your point across.
Yeah.
And that taught me 8 years of that. That taught me how to stay calm in
Wow.
any situation.
Yeah.
And now that
Wow.
my kids
Wow.
I have a 3-year-old and a 1-year-old, it's so easy for me to calm them down and transfer that
Yeah.
calm energy. And literally, I
Yes.
use that calm energy with my toddler like medicine. Like when he is
Yes.
having a temper tantrum, I just sit there and I just literally
Yeah.
like transfer my calm to him. And within minutes, under 3 minutes, I can stop any tantrum he's having. It's like
Yeah.
magic.
Yeah.
Everyone comes to me, Obehi, Cairo's throwing a tantrum. I'm like, watch this.
Yeah.
It's like a party trick.
Bring him here.
Bring him to mama.
Bring him. I will take care of it. Yes.
And within two
Yes.
minutes, I walk into his room. He's throwing things. He's throwing a fit. Within 2 minutes, silence comes out of the room.
Yeah. I think that we make change very intimidating. And I think that if we made it as simple as a skill set, like learning a new language, learning how to roller skate, learning how to swim, things that like we think of on a physical nature, you know, being able to take care of your mental health and learn skills, like instead of my default of yelling, I'm going to be calm, right? That takes a while. And just like any kind of change, right? The neurons have to grow, your brain has to rewire. But lo and behold, the skill set is learned and it can be learned. And so that is change. Change, again, sounds like an intimidating word, but skill set sounds like, oh, I'm learning how to play piano, right? So, I think to make it less intimidating, you realize that you can achieve incredible things if you just make it intentional, where you're like, I'm
Yeah.
going to do this when this is said. And that's all it takes. No big intervention, but just little tweaks in the way that you control your nervous system and react to your nervous system again, right? The nervous system controls and then all of a sudden your heart's beating a little slower, right? You're not shaking because you're not upset, right? There's so many ways that having that thought ripples through the rest of your body, and now you're emanating calm instead of anger
Right.
or any kind of other emotion. So I think that's really it's instructive. But again, it's like you were kind of forced to do it, right? Because the situation kind of called for it, and you're like, wow, this is really helpful for me in my life. So that's really
Yes.
important, you know?
I tell
You
people
know,
it's like a muscle that you have to work out.
that's it. So very similar, right? I think one of the things, and I'm sure that you would agree, one of the most rewarding parts of pediatrics for me, I love seeing the kids. They're growing, they're thriving. It's amazing. I love seeing parents step up
I do too.
and upgrade, right? And really like show up, even when they're terrified, right? How many times, and I'll tell parents, like, this is what's going to happen. And they're like, nope, I can't do it. I can't. And I'm like, frankly, you don't have much of a choice, right? Like, this is actually what's going on. It's going to happen. And they're like, I can't do it. And sure enough, we work through it. We talk through it. 3 months later, they're like, yeah, okay, I'm doing it.
Yeah.
And it's that
Yeah.
kind of thing where it's like parenthood, it's hard because if you think about it, you're like, no, I'm not going to be able to do that. And you end up doing it.
You do.
And you rise to the challenge and
Rise.
you do what you need to do. Being able to do that is so fulfilling to not only experience, but also to observe and to be a part of that growth. It's so compelling and it's so motivational. So that's the dynamic of pediatrics, because people, they're weird. They'll say like the kids are cute, but the parents are a pain, right? Like, a lot
Right.
of
Do you
people
know
will
I've
say
never
that.
do you know I've never
Right?
felt that way.
I've never
felt
felt
that way about parents. I love to educate, and it's an opportunity
love
for me
it.
to
Yes.
educate. That's what makes us pediatricians. That's what sets us apart from every other doctor, because what every other
Right?
specialty will tell you is
Yeah.
the kids are cute, but I could not deal with the parents. And I've never
Yeah.
had that thought once.
No, I love that. And I will say that if a parent is fighting, right? If there's a parent fighting, listen, you're fighting for your kid. So let's go for it. Like, I want you to fight for your kid. I
Right.
want you to advocate for your kid.
Yep.
So maybe I need to explain a couple of more things to you. That's okay. Because I want you to ask me those questions. I don't do well with the parents who are like, I don't know. I don't really care. And I'm like, no, you need to care. I
Yeah.
need you to fight with me. I need you to kind of ask me questions. I want you
Yeah.
to be aggressive, because if
Understand.
you don't advocate for that kid, nobody else does.
Yeah, and I tell a parent
Right.
a similar thing. Like parents who are like asking me a ton of questions and are like saying like I saw this here and I saw this here and I saw this there, and they're like, I'm sorry, and I'm like, no.
Right.
The children that do the best are the ones
Yeah.
who have parents who are resilient and who
Yes.
come back again and again, and who don't settle and come for second opinions and say, no, there's
Yep.
something going on, and
Yep.
who continue to knock that
Yep.
door down.
Yep.
All I ask, and most of I love my patient panel. I adore them. They're wonderful, and they just
Yeah.
me and we get along.
Beautiful.
And what I love about them is they respect my sort of credentials, my intelligence, what I bring to the table. and they're asking me, but it's a real ask. Like, I want to know what you think.
Yes.
And then we can
Yes.
have a dialogue because I also respect them
Yes.
and what they're thinking. And I understand where their concern comes from for their child. I have the same
Yes.
concerns for my
Yep.
child. As long as
Yes.
you are open to a dialogue and we can really
Yeah.
talk from a place of this is what the medicine says about this,
Yes.
then I'm happy for all your questions.
Yes. And I mean, peace of mind is a very hard thing to find. So if I can walk with you to try to find peace of mind, I will go with it.
Yeah,
You're with
same.
that, right?
My mom used
Right.
to say peace
And,
of mind is priceless, and I
it's
have carried that with
priceless,
me. And I tell
right?
parents, if this is going to give you peace of mind, let's do it because peace of mind
Let's
is
do it.
priceless.
Yeah. And having that gut instinct, you're with that kid 24/7.
You
I'm with
know.
that kid 15 minutes for at the most. So
Yep,
like
yep.
if you tell me something is wrong, I will hunt that down. Like we will
Yeah,
hunt that down,
I tell
you
parents,
know?
I say, you know what's different about your child. You know your child best.
Yeah.
Your job is to tell me when something's different. My job is to tell you if it's a problem. Because there are a lot of things that kids do that could be different. To be honest, most of it's not a
Yeah.
problem.
Right. Right.
Kids are weird, and the younger they are, the weirder they are. Babies are like aliens. They do such
Yes.
weird things,
Absolutely.
and most of it's normal. And so it's
Right.
or just not concerning. And so it's
Right.
my job to tell you whether it's concerning it or not, but it's your job to let me know when something is different.
Yeah, absolutely. So my last question, tell me something that your partner or your village does for you.
Oh my God. So, we were talking about this whole postpartum thing. So, my dad's Nigerian, my mom's American. And in
Hmm.
Nigeria and in lots of different ethnic cultures, somebody will come and stay with the mom and take care of her for
Yes.
at least a month, if not more. And that's how
Yes.
it is in the Nigerian culture as well.
Yeah.
So, my grandma came and stayed with my mom for actually years. Um,
Wow.
and so my mom wanted to pay it forward. So with my first one, she was still working, but with my second one, she retired. And she
Wow.
came and she stayed with me, and she's actually still here. She's leaving soon, but
Yeah.
and
It's
that
amazing.
has been irreplaceable. Like,
Right.
couldn't have done all of this without her because I started all these businesses
Yes.
while I was pregnant and postpartum, and I couldn't do any of it without her. It
Yeah.
just is a game changer.
Yeah. And I think the reason I asked this question is because I feel like, again, in just a conventional kind of modern day world, we're told that we should do it all. We're told that we're failures if we do it all.
If we
And
don't,
yet,
yeah.
sometimes if you just pause and say, actually, this person helped me do this. And it may not be everything, but there are people around you that want to support you. There are people that if you ask them something, they will do it for you. Delegating is not so good. A lot of people, myself included, we're not so good at delegating and saying, hey, I trust you with this. Will you help me with this? And
Mhm,
asking for help is seen as a weakness. So I
mhm,
like people who are caregivers to say, who takes care of me? What is something that someone does to take care of me so that you don't feel like you're alone? You don't feel like you're the only person
mhm,
fighting the fight.
mhm,
There are those people around you. Sometimes you just need to activate them. Right? Sometimes you just
mhm,
need to ask them
mhm,
and they'll be there. So
mhm.
that is beautiful.
I have to say, I have a soapbox about the way pregnant women are treated in this country. Well, probably really anywhere, I'm not sure. Because, as pregnant women, you're supposed to do all the same things that you did before you were pregnant. And if you can't, or if you take off work or you scale back, then there's
Yeah.
something wrong with you.
Right.
And I'm like, hold on, let me just let you know something. Someone who's not pregnant and me being pregnant are not the same. We're not on the same level playing field because every time I
Right.
stand up, my blood pressure tanks. I
Yeah.
am anemic. Okay, my pulse is low. Okay, I've got POTS. I had POTS in pregnancy both times.
Wow.
It's like
Wow.
I'm losing weight. Like all these different things
Yeah.
that were not happening before that are happening now.
Yeah.
I'm crazy fatigued, constantly nauseous. All these different things,
Right.
and I'm still showing up the same amount of hours I was showing up before,
Yeah.
still doing all the work, still seeing the same amount of patients, haven't taken off work, still producing the same amount I produced when I wasn't pregnant. I am a superhero right now.
You're
Okay? I'm not
right.
doing the same. I am extraordinary right
You're
now. Okay?
right.
We are
Right.
not doing the same job, just so you know.
Right. Yes. And it's incredible how it really isn't, it's not seen like that. And
I
that's
know.
crazy. It's crazy.
I know.
So thank you so much,
You're
Dr.
welcome.
Okojie, for spending time with us and really opening up our minds to different ways of healing, for all the beautiful caretakers that we take care of, right? And how you take care of yourself. If you guys have any questions for Dr. Okojie, and also if you have any suggestions for future topics, there'll be links in our bio to see all the wonderful social media that she does for education and understanding postpartum, which is really incredible. And we really appreciate your time to listen to us. Thank you.
Thank
Thank you
you.
so much.
Thank you. Thanks for
Bye.
having me. Bye.